AB 109 people here are amazing.
AB 109 has been thrust upon us. This was not something we searched for or asked for. At the same time, AB 109 has become an opportunity for us to really develop meaningful interventions in hopes of protecting the community and at the same time satisfying the very distinctive needs of the clients that are coming out of prison and coming out of jail.
This is not an issue that can be fixed doing the same thing the same old way.
In Contra Costa, we spent about 2 years to develop a reentry strategic plan to really bring together stakeholders from around the county to best determine how we could improve the success of people returning back to our communities from state prison or county jail.
It's basically collaborative. I think the sole purpose of all of us is rehabilitation to our criminal population, our probationers.
And the process was inclusive. We had people who were formerly incarcerated, health and social service providers, folks from the criminal justice system, the courts, and really craft a plan that looked at the full array of services that we need to provide to people returning to our communities and to reduce recidivism.
How we're implementing it is the probation department in collaborations with our community service providers as well as local law enforcement have came together in order to implement services for this population.
We're putting about $4 million of the actual money that we're receiving from the state directly into the communities, and then a lot of the other funding that goes into the departments is also helping out the communities.
True change is facilitated, implemented, and manifests on two spectrums: policy, government agencies, legislation, and the community.
Vernon Williams has been very active in our community. I believe he felt that government was uninterested in what he was trying to do. And I think what we've been able to try to do is bring him in as we open up to the community as well.
We have a very strong collaboration, and part of it is due to, I think, the strong efforts by Phil Cater, the chief probation agent. He has been very active in terms of supporting having these community programs and working with the community programs.
It was refreshing to see a department head really value the insight of the community. I'm a returned citizen. I understood and experienced firsthand the difficulties of someone returning to society from incarceration, of being productive. I have a passion for those people who have a greater tendency to fall through the cracks. We're that pro-social network, we're that last hope. We've just stayed heavily involved in reentry and reintegration, restoration of a human being. We've stayed involved in that work.
One of the things that we decided early on as it relates to the AB 109 population was that we were going to try and put more of the funding that we were receiving from the state to deal with that population out into the communities. So we have a very active working agreement with a number of community organizations to provide a variety of services.
Reach Fellowship is a Gender Pacific organization. It's designed to give a safe place for women and their children, those re-entering back into our society.
The work from Reach Fellowship International has been extraordinary for the women that have unique needs that are coming out and re-entering into our community.
The parole office and the probation department here have been a very strong partner with us. We were doing it sort of single-handedly under AB 109. The county, the chief and probation have referred women to us so that we can help better take care of their needs.
These are women that are coming in often with their children who have nowhere to go, that may have been involved in serious criminal activity and need a place to stay and a place to recover. And she provides a meaningful intervention. I'm not suggesting this solves all the women problems in Contra Costa County, but it's indicative of the kind of particular responses we're able to develop and help develop.
We've been able to provide services to those people who wouldn't have received services otherwise, and those who wouldn't have received as complex of a service treatment plan.
They reach out for the resources to help us. It's not like oh, we look in a book and we don't have that answer, so we just don't have it. They try to find it.
If we didn't have that collaboration, it'd be harder to reach out and get services for the probationers and address their needs. As we have now, we have specific providers that are able to render specific services to the population we're dealing with. So we're not having to reach out, they're more there and willing to give assistance.
I'm 27 now. I've spent the last 8 years in and out of the system. All of my offenses are drug-related theft, drugs, credit cards. I was in prison and I had received a piece of paper that had stated part of the realignment program, and I had no idea what that was, but they were talking about releasing me early, so of course I signed it.
As soon as they walk out the door, we're hooking them up to the right service. It's no longer an experiment. It's now what we do.
And I got out and I had came here. I was no longer on parole. I was on this new AB 109 and I knew nothing about it.
Typical offender comes in, we go over terms and conditions, we talk to them. We go through what we call an assessment. We run them through some questions that we have.
And so once I went ahead and got into it, I did everything they asked of me here at AB 109. I called 3,000 times a week if I wanted to. I called just to say hi. I called just to check in. I wanted to test more often.
I think there's more opportunity for people to make it.
There's a lot of positive energy that we're doing things differently this time, that we understand that it is important to provide individuals opportunities for success and give them the tools to be successful when they leave state prison or county jail.
I have successfully completion of the AB 109 program. I got my license back, I got a job. In fact, here just a couple months ago I had 4 jobs, but I found I was overwhelming myself. And so I cut back on, now I have 2. I'm a counselor now at the GRIP, which is all of the homeless shelters here in Contra Costa County.
The bottom line is a simple bottom line for me. Contra Costa County is committed to trying to do the best we can to stop victimization, to provide good support for our clients, to help local jurisdictions be successful in their neighborhood and feel safe when they go home at the end of the day.
These are definitely people that I believe in the very bottom of my heart take our problems home at night. How can I help this person? How can I help that person? How can I make it to where this isn't the life they live for the rest of their lives?
So if we can address issues earlier in the system, then we're certainly circumventing them from entering into a more deeper into the system. The deeper the penetration, the more difficult it is to get out of it.
If I hadn't have been in the AB 109 program, I think if I would have gone back to parole, I probably would have reoffended, been back in prison.
I believe that if we would not have used the collaborative approach, we would have been stuck in the quicksand of what government tends to do a lot of already, and that is single-mindedly try to resolve issues. When you have more people at the table, you also have more opinions, which it can sometimes be a burden. And what I don't want to have happen is to be paralyzed by a process. But what we've been able to try to do here, and I think we've been successful with here in Contra Costa, is provide an opportunity for people's voices to be heard. And when that occurs, we're all educated.
When we looked at the basic data from the state, their estimate in terms of the recidivist rate for this population was about 67%. We tend to refer to it as a failure rate because we think that's a more accurate term. But when we look at it currently, basically our failure rate for individuals is about 23 to 25%, significantly better than what the state has done.
We're going to measure all of our work continuously as we go forward so that we can spend the money as effectively as possible. We want to show what can work because we think it's important to try to shift more of the money toward reentry services over time so that we break the cycle of recidivism.